Meet Betty. Betty works for a major health plan that is tasked with managing the behavioral health of children placed in foster care. It's estimated that nearly 80% of these children suffer from a significant mental health issue, which is 4 to 5 times the incidence in the general population. As a result of these increased mental health issues, foster youth are often prescribed psychotropic medications at a much higher rate than non-foster youth, which creates the potential for harmful consequences, such as adverse drug interactions or serious side effects. So the question is, how can the health plan improve the coordination and quality of physical and behavioral health services for their members while also managing the cost of care? That's where Alliant can help. Alliant ASO can step in and provide comprehensive, meaningful feedback to the health plan regarding provider compliance, service utilization, and the quality of care being provided to their members. In this case, Alliant ASO met with Betty to discuss the health plan's desired outcomes and priorities for their members placed in foster care. The health plan reported concerns about dangerous prescribing practices and overutilization of services with questionable progress of their members. Together, they partnered to customize an audit tool that delivered feedback on the compliance of the documentation being submitted by these providers, while also providing qualitative feedback on the quality of care being rendered to their members. In addition, Alliant ASO utilized data analytics to identify providers for audit. The first audit completed by Alliant ASO found that 80% of the members placed in foster care were given the same diagnosis of ADHD, and 70% of these members were prescribed 3 or more psychotropic medications with minimal documentation to support the need for these medications. The audit also uncovered service utilization issues, including overutilization of a care coordination service that is reimbursed on a quarterly basis. The provider had an automatic billing process in place with no evidence that the care was actually being coordinated. In addition, the audit revealed the use of multiple add-on codes for medication management with no documentation to justify the increased billing and multiple cloned notes with no documentation of member behavior or response to intervention. This audit showed clear evidence that the health plan's supposition of possible issues within their provider network was correct, especially the providers meeting the behavioral health needs of their foster youth. With the support and expertise of Alliant ASO, the health plan was able to uncover dangerous prescribing practices and service utilization patterns that were inconsistent with the documented needs of their members. Alliant ASO provided actionable evidence that allowed the health plan to take appropriate action, including referring this provider to the quality of care team for further investigation.